Hello everyone, happy evening, a very good evening. Am I audible and visible, everyone? Hi, happy evening, everyone. So I hope and I believe all of you are doing well, and this is the Fast 5 today. I hope you have solved the questions on the Medsynapse app. It was a free quiz which was available. So tell me, how did you fare in the quiz and how did you like the questions there? Yeah. इच्छा तो बहुत थी अप्रैल फुल बनाने की और क्लास बंक करने की, but since I had committed, I did not have that option. राइट, नहीं तो मैं अप्रैल फुल का रीजन दे सकती थी. Yes, absolutely. Yeah, I hope and I believe all of you are doing well. Thank you so much, Maya, for reminding me that. So tell me, how was the quiz? How many questions did you get right out of the 5 clinical questions that we had? कितने right आए? Amazing, Purvi. That's great. 4 on 5. That is superb. क्या बात है, Rahul? 5 on 5. Very good. Amazing. That very good is not for quiz, but for you, Rahul. Very good. Happy Meal Medico, 4 on 5. Questions and PDF is different, is it? Oh, I'm so sorry. My bad. Basically, शायद मैंने next quiz के questions next quiz के questions मैंने leak कर दिए शायद. I am in that sleepy state today. तो मैं actually जो PDF लेके आई हूँ, ये PDF भी दूसरा है. That's so I made you an April fool of yours and myself also today by getting the different PDF. Yes. So I'm really sorry for this. Questions actually दूसरे हो गए हैं, but कोई बात नहीं. अभी दूसरे और 5 questions कर लो. In next session में we will discuss the previous fast 5 वाला जो था, है ना? I'm really sorry for that. Never mind. So let's solve these questions together. That's what I was wondering कि वो वाला PDF कहाँ चले गया जहाँ वो immunoglobulin वाला question था. ठीक है. हाँ, हो गया अप्रैल फूल हो गया, सबकॉन्शियसली हो ही गया. चलो, let's solve this question and tell me what do you think will be the answer to this one. Schedule for interns will appear for NEET PG 2025. ठीक है शिवम. चलो, read the question and tell me what do you think will be the answer to this one. As I've always told you that whenever there are lengthy clinical questions like this, you should always start reading from the last line. Okay? Always start reading from the last line. That will help you to answer this question, the last line and the last second line. So which of the following mechanisms is the most likely cause of this patient's bleeding disorder? Lab studies show a deficiency of von Willebrand factor. The last 2 lines basically help me to understand what is this question about. And von Willebrand factor, remember, is basically platelet adhesion. When there is deficiency of von Willebrand factor, it is platelet adhesion which is going to be defective. Von Willebrand factor is important for platelet adhesion to the endothelium. Okay, so that is decreased platelet adhesion. So like the previous one, I've got some snippets from the first aid here. We have discussed this in the app also, the bleeding disorders from first aid. Von Willebrand disease basically has what disorder? The bleeding time is increased and the APTT is increased. This is very, 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 very important. Increased bleeding time plus increased APTT basically is von Willebrand disease, asked so frequently in the exam. Why does the APTT increase with von Willebrand disease? Because it stabilizes the factor 8, which is a factor of the intrinsic pathway, right? I hope all of you remember the mnemonic happy and wept. Okay, so APTT is basically for intrinsic pathway, PT is for extrinsic pathway. Okay, so intrinsic pathway coagulation defect. Why? Because decreased von Willebrand factor increases the PTT because it protects the factor 8. There is defect in the platelet plug formation because there is decreased platelet to von Willebrand factor addition. What is the inheritance of von Willebrand disease? Majority it is autosomal dominant. What is the story for our autosomal dominant inheritance? Medsynapse app, the video there. Inheritance short में भी discuss किया है. Von, right? So the fight between the tall man and the dwarf man, and the tall mota man wins, won the fight. So remember von Willebrand disease, von Hippel-Lindau disease. Okay. This is the most common inherited bleeding disorder, presents with menorrhagia or epistaxis. What do you give in treatment? Is desmopressin. Why? Because it helps in releasing the von Willebrand factor stored in the endothelium. I hope this is clear with everyone. Right, so desmopressin is given in the treatment. Okay, desmopressin is given in the treatment. Okay, so remember that von Willebrand factor platelet addition will be defective here. Decreased GP2B3A is basically for Glanzmann's thrombasthenia, the Glanzmann's thrombasthenia where platelet aggregation is defective. So remember in Glanzmann's GG it is platelet aggregation which is defective. Okay. Where do you have increased antiplatelet antibodies? Basically, you have this is ITP. Okay, immune thrombocytopenic purpura. Okay, yeah. Decreased secretion of the platelet granular contents is seen in condition like Hermansky-Pudlak syndrome, where you have oculocutaneous albinism also. Okay, yeah. Devesh एक बार बोल दिया, commit कर दिया तो करना ही है. There is no going back from it. Right, so I hope everybody is clear with this. So the history of a woman with heavy menstrual bleeding, right? There is easy bleeding with minor cuts ka history also. Several family members have the similar history, telling you that ये familial है, ये autosomal dominant है. Okay, ये autosomal dominant है. Is this clear with everyone? Right? So that was the first question here. Going on to the next question. Tell me, what do you think will be the answer to this one? So new questions for everybody because none of you have solved this quiz. What do you think will be the answer to this question? Yes, waiting for the answers. A woman comes with vaginal discharge, itching, soreness. Very good. You know that it is candida, but what is the question asking? Answer C कैसे होगा? What do you give for candida? Right, the thick white vaginal discharge telling you this is candida. The vaginal pH is 4.2, acidic normal is maintained. So you are giving an oral agent. कौन सा oral agent देते हैं? Why many of you are saying it is C, the pore formation? Pore formation कौन करता है? Amphotericin forms the pore. Do we use amphotericin? No, we use azole, the fluconazole. So what is the mechanism of action of azoles? Azoles basically are inhibition of the demethylation reaction. They inhibit the demethylation. Let me quickly show you this snippet from the first aid again and quickly telling you about antifungal therapy. So in the antifungal therapy, the fungal cell, it is having the cell wall, right? Then the membrane inside it, the cell membrane, right? And you have this ergosterol which is present in the cell membrane, and in the cell wall, you have the glucan, right? The glucan wala. So remember that what is happening here is squalene to squalene epoxide to lanosterol to ergosterol, and that is how it is then going in the cell membrane. So the first step, the squalene epoxidase, this is inhibited by terbinafine. Okay, so conversion of squalene to lanosterol is inhibited by, that is inhibited by terbinafine. So remember S and T. Squalene epoxidase inhibited by terbinafine. Ergosterol synthesis inhibiting the enzyme 14-alpha demethylase are all the azoles. Okay, they are all the azoles. So azoles inhibit ergosterol by inhibiting the demethylase. Next you have the nucleic acid synthesis is inhibited by फ्लूसाइटोसिन, सिमिलर टू योर एंटी कैंसर ड्रग्स, जहां पे भी आपका बेस का नाम आता है जैसे फ्लूसाइटोसिन, it inhibits the nucleic acid synthesis. The cell membrane integrity, basically forming the pore are the polyenes. Pore is formed by polyenes, that is amphotericin B and nystatin. Okay, that is nystatin. And then you have echinocandins which are acting on the cell wall, not the membrane, containing that candin, the glucan wala candins are your caspofungin, micafungin, anidulafungin. These are echinocandins acting on the cell wall. Now in candida we give fluconazole, which is an azole inhibiting the 14-alpha demethylase, inhibiting ergosterol synthesis. We can also give nystatin, but remember that nystatin is given topically while fluconazole is given orally. The question specifically is asking about oral agent, not the topical agent, and that is why the answer, which is basically we are giving fluconazole here, it is demethylation reaction, so it is inhibiting the ergosterol synthesis. Is this clear with everyone? What is that drug which inhibits the DNA and RNA synthesis? The nucleic acid synthesis wala drug is flucytosine, which is given in cryptococcal meningitis along with amphotericin. Pore formation is amphotericin B or nystatin. Glucan wala, prevention of cross-linking of glucan is echinocandins. Okay, candins is the glucan. Okay, so anidulafungin, caspofungin, that is the candins. Is this clear with everyone? The image is showing basically the hyphae, the yeast form, the hyphae form of candida. I hope all of you remember our mnemonic from short 5.0 of that which vaginal discharge wala out of bacterial vaginosis, out of trichomonas and candida. Which one has the acidic pH which is there, the pH 4.2? Remember that candida is candid with acid. Candida is very candid with acid. It likes to be candid with acid. It can play with the acid. So acidic pH is only candida. Okay, acidic pH is only candida. Is this clear with everyone? Where do you see the clue cells? कौन से vaginal discharge में clue cells होता है? Remember A, B, C. That was our mnemonic. AIIMS criteria are used for bacterial vaginosis, and it is clue cells present in bacterial vaginosis. Do you remember for trichomonas, all the TR for trichomonas has the TR. What is that TR for trichomonas? It is trophozoite only. There is no cyst stage for trichomonas. It is strawberry cervix for trichomonas. The drug of choice is metronidazole for trichomonas, and it is tree-colored discharge. What is the tree-colored discharge? That is green-colored discharge. Okay, that is green-colored discharge. So, trophozoite, strawberry, metronidazole, tree-colored discharge, all this is trichomonas. We have seen all these mnemonics, right? Clear with everyone? So, we have discussed this topic of vaginal discharge. The question is specifically on antifungal drugs. So, remember this mechanism of action of antifungal drugs is very, very important. Okay, very, very important. Okay. All right, going on to the next question. Let's see how many of you get this right. We have again discussed this in our app videos. So the application of how just one fact can be put into a clinical question. Yes, very good, Naveen. Treat partner 2. The TR is also for the treat partner also. Very good. So someone has got that right. Very good, Sarika. Right. This is basically going to be, the answer is going to be muscle. Why? Because this is the tumor which is showing large quantities of desmin in the tumor cells. It is showing desmin in the tumor cells. Okay? Yes, Rishabh, you can do that and just complement it with the PYQs. Majority of the topics I've discussed there in pharmacology along with all the mnemonics. So that is the crux that you need to do. So desmin is basically, remember, smooth muscle. Okay, so remember that desmin, SM, is the smooth muscle. So this is muscle curve. That origin is the muscle. Okay, and epithelial वाले का क्या होता है? Keratin, epithelium, cytokeratin. Okay, that is cytokeratin. So this is your table, your snippet again from first aid, telling the important immunohistochemical stains. Remember that desmin is the muscle tumor like rhabdomyosarcoma. On the other hand, Vimentin, MEME, is for mesenchymal. So fibroblast, endothelium, macrophages, these are mesenchymal origin. So that is Vimentin. So remember the mesenchymal tumors, the endometrial carcinoma, meningioma, MEME, this is all Vimentin. Okay, this is all Vimentin. Is this clear with everyone? Did we see in our last fast 5? PCAM1 is CD31, right? PCAM1 is CD31. What was the role of PCAM? The dipedesis, that is what we had learned. So that is a marker of endothelial cells, vascular tumor like angiosarcoma. Okay, angiosarcoma. Epithelial cells, cytokeratin. Okay, epithelial cells is cytokeratin. Hairy cell leukemia is TRAP, tartarate resistant acid phosphatase. Right, we have seen this table. I hope all of you remember that. S100 is basically for neural crest cell, जिससे आता है melanocytes, Schwann cells, and even your Langerhans cell histiocytosis. Okay, even the Langerhans cell histiocytosis. So clear with everyone? So the answer for desmin, remember SM, smooth muscle, it is your muscle wala tumor. Vimentin is for mesenchymal tumor, meningioma, and endometrial tumor. Okay? Right, so that was the third question. Going on to the fourth one. Read the question and tell me what do you think will be the answer to this one. What is the diagnosis here and what is the answer here? I hope you are able to see the labelings. Right? A, B, C, D, E, F. Correct. The correct answer here is going to be F. F is the site which is affected here. What is the diagnosis in this clinical case which is given here? What is the diagnosis? Is it SIADH or it is central diabetes insipidus or it is nephrogenic diabetes insipidus? What is that? Yes. So basically the urine output is 6.1 liters per day, which is very, very significant. At the same time, sodium concentration is 158 on the higher side. So there's a lot of diuresis which is happening. So anti-diuresis is not there. So that basically means there is ADH deficiency. The anti-diuretic hormone is not there. So ADH deficiency is diabetes insipidus. Remember that polyuria. Any diabetes, be it diabetes insipidus, be it diabetes mellitus, has polyuria. So when they are telling you that the urine output is 6.1, it is polyuria, it is diabetes insipidus. Head injury is the cause of the central diabetes insipidus here. Head injury is the cause of central diabetes insipidus here. Okay, right? So what is happening here? He is thirsty because there's a lot of sodium. Water is going out. There's just sodium without water. So that sodium wants water, and that is why the patient is thirsty as well. Okay, so remember that this is basically your central diabetes insipidus. When ADH, what is the site of action of ADH? It acts on the collecting duct. So that is the site F. So ADH acts on the collecting duct is what we should know. Okay, it causes antidiuresis. How does it cause antidiuresis? So ADH acts on what receptors in the kidney? It acts on V2 receptors in the kidney. Remember, we have V2. Two kidneys have V2 receptor. V1 is in the blood vessel. Okay. So it acts on the V2 receptor, induces that aquaporin channels on the luminal side. The aquaporins take the water in, and that is how it causes antidiuresis. What cells of the collecting duct? It is the principal cells of the renal collecting duct. So this snippet from the first aid, ADH, which is also called vasopressin. Vasopressin, that means it is a vasoconstrictor. Via which receptor? Via V1 receptor. Do you remember from a physiology short that V1 is what kind of receptor? Is it GS, GI, GQ, tyrosine kinase? कौन सा टाइप का receptor है the V1 receptor? Remember, any vasoconstrictor, calcium wala is your GQ subtype. Okay, that is the GQ subtype. It is synthesized in the hypothalamus, comes in the posterior pituitary, and from there it is secreted. Okay. The function is blood pressure, V1 receptors in the vessel and V2 receptors in the kidney. The serum osmolality, it decreases the serum osmolality and increases the urine osmolality because it is reabsorbing water. तो ब्लड में ज़्यादा पानी है, osmolality सीरम की कम होगी लेकिन यूरिन की बढ़ जाएगी, concentrated urine होगा. Aquaporin channel in the principal cells of the renal collecting duct. So ADH levels is decreased in central diabetes insipidus, it is increased in nephrogenic diabetes insipidus. What do you use in treatment is desmopressin, which is ADH analog. Is this clear with everyone? Right? So remember that this is very, very important point to be remembered that ADH acts not on the descending limb, ascending limb, PCT or DCT. It acts on the collecting duct. Okay, very, very important. It acts on the collecting duct. The principal cells of the collecting duct. We should always know this. Is this clear with everyone? Right? Remember that this ascending limb, this is impermeable to water. This segment is impermeable to water. So ADH वहाँ पे तो act करेगा ही नहीं. It will not act there. Okay? Going on to the next question, the fifth question here. Just by looking at the image also, you can answer this question. "52-year-old woman, 10-year history of recurrent UTIs. The pH is 7.6. Okay. And you are seeing this image here. So what is it? Which of the following is the most likely causal agent? What do you think would be the answer to this one? Very good. The answer is Proteus vulgaris. Very good, Abdul. Streptococcus. Why Proteus vulgaris? Because what are we seeing in this image is, what are we seeing here is the stone which is taking the shape of the collecting system. So basically it is showing the staghorn calculus. Okay, it is showing the staghorn calculus, which is commonly associated with Proteus infection. Why? Because Proteus is urease positive, breaks down the urea, ammonia comes in, there is alkaline environment, and in the alkaline pH, look at the urine pH, It is alkaline. Alkaline urine pH, right? The true white, the triple phosphate stone, staghorn, which is it precipitates. What is the composition of the staghorn? Basically, this is triple phosphate. Calcium, ammonium, magnesium, phosphate. Okay. What is the shape of the crystal with this true white? What is the shape of the crystal? Remember white. Where do we wear the white color clothes? We wear the white color clothes for a funeral. That means funeral is the coffin lid appearance. The true white is the coffin lid appearance. Very, very important. Which is the other organism which is urease positive? Right. The other one is the Klebsiella. Okay. The other one is the Klebsiella, which is urease positive. So remember, Proteus, Klebsiella are commonly associated. Okay. Yes. So look at the snippet from first aid again. The true white is ammonium magnesium phosphate. Okay. It is precipitated in alkaline pH, and that is why urease positive organisms. It is radio opaque, hyperdense, coffin lid appearance, sarcophagus. Right, it is caused by urease positive like Proteus or Klebsiella that make the urine alkaline, leading to staghorn, right? And surgical removal is generally required here. Okay, surgical removal is generally required here. Okay, so remember the trick, the mnemonic for true white is when I write the true white. So remember true white, S for staghorn calculus, TR for triple phosphate composition, U for urease positive, and white for the white clothes in the coffin lid. Okay, the coffin lid appearance. Okay, so remember that staghorn, triple phosphate, urease positive, and coffin lid. So true white, that itself is your mnemonic for the true white, the staghorn calculus. Okay. So these were the real fast 5 questions for today. A quick review of the first 5 questions that we have seen. First one, von Willebrand factor is for platelet adhesion. There is increased BT and increased APTT. Very, very important. For Candida, we give fluconazole, azoles act by inhibiting ergosterol synthesis by basically inhibiting the demethylation. Remember, Candida is candid with acid. Okay. Next one was desmin is muscle, smooth muscle wala. Vimentin is mesenchymal. Okay, epithelial is cytokeratin. Next one, urine output 6.1, polyuria in a patient of head injury. This is diabetes insipidus. So, ADH acts on the collecting duct. V2 receptors in kidney is what we should remember. Next, the staghorn calculus, alkaline pH is Proteus, the urease positive, leading to alkaline pH. Okay, leading to alkaline pH. So these were the fast 5 questions for today. The questions that we were supposed to discuss that you had actually solved. We'll be doing it in the next class. Okay, I'll give you an update on the next class. Right. So I'll give you the update for the next class on the Telegram group. And till then, goodbye, take care, and keep studying, keep revising, and keep Medsynapsing, keep winning. And stay connected on Telegram for all the updates about the upcoming sessions. Right. Thank you so much for joining in, everyone, and see you again soon. Goodbye, take care.